Namaste and good afternoon. On behalf of Apollo Hospitals, I'm delighted to welcome you to yet another session of our Corporate Health Series. This is Dr. Srinidhi Chidambaram here. This series aims to bring focus on health issues that you, as part of the corporate world, are at particular risk for. We hope the series helps you to function at the peak of your productivity with minimum stress and maximum well-being. Have you ever had a gut-wrenching experience? Do certain situations make you feel nauseous? Have you felt butterflies in your stomach? We use these expressions for a reason, actually. The gastrointestinal tract is sensitive to various emotions like anger, anxiety, sadness. Many of them can trigger symptoms in the gut. The brain does have a direct effect on the gut. But did you know that the connection is now thought to be going both ways? A troubled gut can also send signals to the brain, just as a troubled brain can send signals to the gut. So hidden in the walls of the digestive system, there is a kind of a nervous system that does have a communication with the way we think and feel. And this is called the enteric nervous system. This, along with other nerves like the vagus nerve and the microbiota the microorganisms in your gut, are now thought to play an important role in overall health and well-being. And this is one of the important areas where research is ongoing and more knowledge is being created on this gut-brain connection. So we thought it would be important to speak to an expert and understand more about it, because this directly also impacts our daily life and our daily stresses and our overall health. So to discuss this interesting topic with us, I have great pleasure in welcoming Dr. D.K. Raghu, who is a distinguished gastroenterologist at Apollo Hospitals, Jubilee Hills, Hyderabad, over the last 23 years. Dr. Raghu's extensive academic background includes MBBS, MD in internal medicine. He's American board certified in internal medicine and gastroenterology, and has completed a fellowship as well in gastroenterology and hepatology from Seton Hall University in 2011. Specializing in a wide range of gastrointestinal conditions, Dr. Raghu is well known for his expertise in treating various gastrointestinal disorders involving the pancreas, cancers, digestive disorders, acid reflux, peptic ulcers, procedural skills encompassing endoscopies, colonoscopies, liver biopsies, esophageal dilatation, and so on. Dr. Raghu is also proficient in advanced techniques like gastrointestinal endoscopic mucosal resection and many such complex procedures. I think it will be wonderful to hear from him what these kind of mind-gut connectivity and the mind-gut connection and its overall impact on health and well-being today. Thank you so much, Doctor, for joining us in this discussion.
Thank you for having me.
So can we begin by asking you to explain to our viewers in simple terms what this gut-brain connection is all about?
So when we talk about the gut-brain connection, we first need to talk about the diagnosis that's the need of the hour, which is irritable bowel syndrome, which probably is the background for all this gut-brain axis. So irritable bowel syndrome, IBS, is nothing but a chronic disorder where people tend to have, a mix of symptoms such as diarrhea or constipation or pain or a combination of all three of them, which is probably the most common type of irritable bowel syndrome. Although we can't pinpoint one particular cause for this irritable bowel syndrome or IBS, the most common theory or hypothesis is the gut-brain axis, which, the gut, which is the intestines, and the brain, which is the central nervous system, both have their own nervous system, like you mentioned. The central nervous system for the brain and the enteric nervous system for the gut. And both of them, bidirectionally, they have a connection between each other. Basically, the gut gets its signals from the brain. And sometimes when the brain itself gets its symptom or signals from the gut. So that's the bidirectional connection. There's a hypothalamic pituitary axis, which probably helps communicate between the central nervous system and the enteric nervous system. That's what the gut-brain axis is. And, this axis may not be just directly neural connection. There are several neurotransmitters that act as a communication or a connect between the brain and the gut, causing these signals to be transmitted bidirectionally, vice versa, causing, association between these two major systems of the body.
So what are the common signs and symptoms that might indicate to an individual that there is something amiss in this connection?
So again, we have to go back to the irritable bowel syndrome that I mentioned. The most common symptoms of IBS is what are some of the signs of dysfunction or activity of the gut-brain axis has come into picture is what we need to think about. So if you think about the gut per se, someone says, I feel bloated all the time. I feel full all the time. I feel early satiety. I have a lot of bowel movements, or I have very little bowel movements. And you've ruled out every other cause inside, a structural cause inside. You've ruled out ulcers in your stomach. You've ruled out infections. You've ruled out a cancer. You've ruled out inflammatory bowel disease, everything. That's when IBS comes into picture. So the gut symptoms would be the bloating, gas, flatulence, early satiety, reflux can sometimes be the most common symptoms. A lot of belching and burping and inability to poop or having more frequent bowel movements. Those are the gut symptoms. When it comes to the brain symptoms, lack of interest, mood instabilities, anxiety, depression, headaches, and all these could be signs of the brain axis not functioning properly. So these are some of the telltale signs of the brain and the gut, which could be as a consequence of malfunction of the gut-brain axis, or activation of the gut-brain axis, you should say.
So what would be the one thing that people, in the sense like in nutrition, because the gut largely, people do say that, what you eat also impacts all these things. So what would your first advice be regarding the diet?
So your gut is what you feed it. The fuel you give it is what it's gonna run on. So you give it harmful things, it's gonna show you what it feels like when you give those harmful things. You give it the right things, it's gonna be happy with you, and then it's gonna react in a happy way. So you are the best judge of, over a period of time, you would know what your trigger foods are. It depends. Some people may be intolerant to milk products, lactose. So you see a direct relationship with lactose products because the enzyme that's required to digest lactose, which is a sugar in milk, the enzyme is lactase. With age, in some patients, the lactase gets deficient. So when you take the lactose products, anything with raw milk, the lactose does not get digested, it goes through you without getting digested. You feel all the bloating, gas. Same thing with fructose intolerance or sucrose intolerance. These are some of the things you could see. So it's the fuel that you give your gut. And what are some of the things that you can give your gut is what your question is. So once you find the trigger foods, you need to eliminate those trigger foods. That's the first and foremost thing. The other common things you could do is, give it an adequate amount of water so that, that acts as a medium where everything mixes itself. Avoiding excessive caffeinated drinks, avoiding excess alcohol, avoiding stimulants to the intestine, which can alter the motility or the permeability of the intestine. Avoiding artificial sweeteners could be one of the things that you can avoid. Avoiding a lot of trigger foods such as spicy, oily, fried, fatty food can also be one of the indicators. Avoiding excess meat intake also can sometimes be that. Although some people say, I eat a healthy diet, there are some foods that, the soluble fibers may be good for a lot of people who have constipation issues, but some who have a very fast gut motility, the soluble fibers can increase the motility to an extent that you have frequent bowel movements. So you need to find the trigger that's causing you these symptoms, maintain a food diary, find the trigger foods that's causing these, and avoid those trigger foods.
So the other thing that we often talk about is how stress impacts the gut. So how does that happen? Does it further worsen the symptoms?
Yes, again, it goes back to the same gut-brain axis theory where, psychological stress can transmit itself to the gut through the gut-brain axis. When the gut gets its commands from the brain, when you send distress signals from the brain to the gut also tends to take up the distress. In some patients, the distress could mean diarrhea. In some patients, the distress could mean pain. In some patients, the distress could be a spasmodic colon causing constipation. In some patients, it could be a combination of all three of them, where there are periods of diarrhea followed by constipation mixed with pain. You have a bowel movement, the pain decreases, only to come back again after a few minutes to a few hours. So when it comes down to the actual reason why this happens, serotonin is one of the transmitters, and the gut is probably the biggest secretor of the serotonin in the body. And then it's taken up by the serotonin receptors in the intestines, and it gets transmitted to the brain. It's a feel-good hormone. So when the serotonin secretions are altered, it can alter the motility of the gut, it can alter the permeability of the gut, it can alter the fluid content in the gut, leading to it transmitting to the brain, causing all the mood swings, causing all the anxieties, the depressions, as a consequence of the neurotransmitter that is actually secreted in the gut. So that is how the mood swings can happen depending on what you feed your gut.
So you were also mentioning that when irritable bowel is often diagnosed once the structural issues are eliminated. So what would your advice be to an individual? When should they seek medical help, and what is usually done to differentiate a structural disease from something that is a bit functional and maybe psychosomatic?
You hit the right word, functional. So IBS is a diagnosis of exclusion. Anyone who comes with symptoms that are typical of any gastrointestinal symptoms, like the ones I mentioned, the gas, the bloating, the flatulence, the pain, the frequent salivation or frequent reflux issues, you have to rule out a primary organic cause in the body. Like I said, an ulcer in your stomach, H. pylori infection, inflammation of the bowel, bacterial overgrowth, inflammatory bowel disease, any infective causes, a primary colon cancer, inflammatory bowel diseases such as Crohn's disease, ulcerative colitis. You have to rule these out. How do you rule these out? Basic blood tests, an ultrasound of the abdomen, if needed, an endoscopy with biopsies of your stomach and small intestine to rule out H. pylori, Helicobacter pylori infection, small intestinal bacterial overgrowth, breath tests to rule out those, a colonoscopy, which is visualization with a camera of your large intestine to rule out inflammatory bowel disease such as Crohn's and ulcerative colitis, entering into your ileum, your small intestine, to rule out small intestinal Crohn's disease, probably cross-sectional imaging of your abdomen with a CT scan of the abdomen or a CT enterography. Once you do all these tests, you rule out a structural cause of your gastrointestinal tract. That's when you get into the irritable bowel syndrome field, and that's when you tend to think of functional gastrointestinal disorders. Like I said, it's a diagnosis of exclusion. You've ruled out other causes. This is when you entertain the diagnosis of IBS, and then you manage it accordingly.
So I think we'll now move on to the corporate world, where several of the factors do impact this whole mind-gut connection. So what would your advice be to people who are working in high-pressure environments, where all these risk factors abound? Poor diet choices, maybe not having meals on time, maybe stimulants, and then maybe stress, of course.
Yeah.
All these things are there. So how do you manage them?
Yeah, like every other field, which is competitive, I feel the corporate world, with the ever-changing or needing to upgrade themselves, the stress levels probably, I wouldn't say were the same, or maybe higher in some instances. So to keep up with this, probably the extra grueling hours that they have to put in, the odd hours that they have to work in, leading to altered food habits, altered bowel habits. Maybe their water intake has been decreased. What they eat every day may not be the same because they eat at odd hours. They may, order food outside on a regular basis. What they eat, they can have frequent gastrointestinal upsets because of the food that they order from outside. May not be the healthiest of choices just for the sake of convenience. Where they eat, they may not have the options to order healthy food, or may not be available on a quick basis. They may have to use stimulants, like I said, excessive caffeine intake, or excessive lactose intake, or they could have some energy drinks to stay awake through the night. All these can lead to altered gut issues. At the same time, the alteration of these causing symptoms such as constipation or diarrhea, they may have to use medications on a regular basis to keep their gastrointestinal tract on track. So all these, as a combination of all these, can have a deleterious impact on their gastrointestinal tract, leading to these frequent episodes of the bloating, the reflux issues, frequent gastrointestinal upset, frequent flatulence, diarrheas or constipations, blood in the stool as a consequence of constipation and leading to hemorrhoids. All these can be a part of the sequence of events that lead to this IBS in the corporate world. So stress, irregular eating habits, and dietary non-compliance, all these could be a cause for symptoms in the corporate world.
So what happens if somebody is diagnosed with IBS? How is it treated?
So there's no one simple treatment for IBS. It is a multi-pronged approach. You don't just, you can just treat the symptom, but it's not going to be, it's like just putting a Band-Aid on something. You want long-term approach for an IBS would include finding the actual cause for this irritable bowel syndrome. I know they say, I just have diarrhea, doc. I just have constipation. I just have pain. But what is causing you this? So if we can get to the root cause of it, treat it. But treatment would include, not only would it include, dietary modifications, like we discussed all this while, behavioral modifications also can play a big role. Also, if behavioral modifications, cognitive therapy, self-help questionnaires, self-help treatment measures, hypnotherapy sometimes can be good means. Dietary adjustments can be, adding yoga and meditation to your daily routine can also help you. Avoiding the stimulants, like I said, artificial sweeteners, caffeines, all the stimulants that they use to stay up all night, avoiding those can be play a big role. After that, medications. Not only medications targeted towards your gut or the specific symptoms, some medications also to work on the brain, also to calm your mind down, to act as psychosomatic therapy to your brain also would be some of the means you manage irritable bowel syndrome. Like I said, it's not one simple treatment. It's a multi-pronged approach towards the symptom complex and the root cause.
Let me ask you about the other term that is bandied about quite frequently, which is all about the gut microbiome. So we hear a lot of supplements, a lot of detoxes, which are available, widely advertised on social media. So there are all kinds of remedies being given for it. So what is the gut microbiome and how does one cultivate a good gut microbiome?
How there are bacteria, our gut has millions and millions of bacteria in it. Not all bacteria are bad bacteria. We do need good bacteria because they help in digestion. So just the moment we say they are bugs, they're bacteria, doesn't mean we need to get alarmed. We need a good mix of them. And when you have a widespread flora or when you have a diverse set of bacteria in your gut, digestion goes on smoothly. When you don't have a diverse set of bacteria, when you just have one set of bacteria is when digestion slows down. That's when we tend to have problems. So having a diverse set of bacteria is a good gut microbiome. When you don't have that good microbiome, it's a condition called gut dysbiosis. So alteration of the good bacteria or the good microbiomes causes a lot of issues like the ones I mentioned. So how do you get a good gut microbiome? Having a good, what you put inside is what determines your good gut microbiome. Having whole foods, whole grains in your diet, having a lot of green leafy vegetables, having a good mix of carbohydrates, proteins, and fats is probably the right way to do it. Avoiding foods that can have a deleterious effect on your gut microbiome, excessive alcohol intakes, excessive artificial sweeteners, and excessive sugars, adding a lot of fried fatty foods, all these can affect your gut microbiome. When that happens, you tend to have these symptoms on a regular basis. You also feed your gut with good probiotics and prebiotics that can actually help these gut microbiome to develop on their own so that they flourish in your gut, leading to a healthy and good digestive system.
So is it advised that people should take supplements, or how does one have a good probiotic, prebiotic?
Having prebiotics are the foods that you get. So you can have foods that nourish these bacteria on a regular basis. Like I said, the prebiotics sometimes could just be the green leafy vegetables, having a good source of nourishment to the fermented foods that you have. The normal natural probiotics that you have, the natural probiotics that you could use could be something as simple as a yogurt, the kefir, the kombucha, the sauerkraut, the misos, and all these. They are natural probiotics that you could use. You can also have some prescription strength probiotics that you could use. There are thousands of companies that sell prescription strength probiotics. So having a good, healthy, nutritious diet, whole grains, having them on a regular basis, a mix, having varied colors in your diet, also multicolored foods. People may think, what kind of diet is that? But having multicolored foods gives you more and more prebiotics to your diet, rather than just sticking to one sort of meat-based diet, just a plant-based diet at all. Having a good mix of all the essential nutrients would be the right way to feed your gut microbiome.
How do you really, is there a test to determine whether your gut microbiome is all right or not, or is it just purely by your symptoms?
Symptoms is the easy, because you don't have symptoms, you're feeding, everything is everything's going on well. That means you have a well-balanced gut microbiome. In the event you suspect that you have some gut issues or microbiome issues, there are several companies that do a gut microbiome test. They test the stool sample to see the amount of gut microbiome, the variety of microbiomes you have in your stool, and the report tells you if you have a widespread variety of gut microbiome and the quantity of gut microbiome too, which can help you, add some foods or supplements to your diet to improve your gut flora and to prevent the gut or treat the gut dysbiosis, which I was talking about.
Is there anything else that you would like to advise our viewers about gut health?
Eat at the right time, sleep at the right time, avoid excessive stimulants, do not overindulge in things that could be harmful to your diet. Always maintain a food diary. Find out the trigger foods that you have. Avoid the trigger foods. Feed your gut the right food. It's the fuel that you give in, like I said. Give it the right fuel, it's going to be happy with you and it's going to interact well with you. You don't, and you're going to have to face the music from your gut.
Thank you so much, Dr. Raghu, for this wonderful discussion. Viewers, I hope you enjoyed this session. Stay tuned for more till we see you the next time. Thank you and namaste.